Dermatology of Wright State. She's the dermatology subsection chief in the Department of Medicine at Baptist. Actually that's wrong, she's now the chief. And she's a fellow of the American Academy of Dermatology and diplomat of the Board of Dermatology. Lastly, she's researched and published in many peer-reviewed journals and textbooks. And over the last 5 years, she's lectured at numerous laser surgery and dermatology meetings and workshops, not just in the U.S., but around the world. She's far more qualified to speak to that particular issue. And we're going to allow her to speak, we're asking her to speak on our behalf for the next 10 minutes or so. Then I'll get up and say a few more words and then ask others on our side of the petition to speak some of their concerns. Dr. Waibel?
Thank you, Jeff. It was very nice, and thank you for allowing me. This is a beautiful tennis club. I do have a PowerPoint for you, but you can't see it, so I'll just talk a little bit, and I'm happy to entertain questions. Really, I'm here as an educator. As Jeff said, I'm the chief of dermatology at Baptist Hospital, and I'm an educator, so I'll just give you some medical information, and maybe in the meanwhile, it'll help you personally. So the first thing really to talk about is the sun, and it is a major topic here in South Florida because the #1 cancer in the human body is skin cancer. We are #1 in the world in South Florida. It's a little disappointing as a dermatologist. It used to be Australia and New Zealand and then California and then South Florida. We are now #1, and I've lectured in New Zealand and Australia. What they have done is put every indoor or outdoor sport under a cover. They have their children wear clothing and sunscreen, and if they come to school without such attire, they are fined, and as a result, their country has saved billions of dollars in healthcare expenditures. The other bad news about South Florida is I met with the Melanoma Research Alliance on Friday. They came from New York to meet with me. We are #2 in the world in melanoma. We used to think melanoma was mainly genetic, but now we know that a lot of it is due to sun, and California is #1, Miami is #2, or South Florida is #2. Now what's scary about melanoma is your survival rate when you get a melanoma at 10 years, depending on what stage you are, can be as low as 10%. And I have 4 patients in my practice right now that are stage 4 and that probably have 3 months to live. So these aren't necessarily, and a couple of them have 3 kids and they're in their 40s. So these aren't necessarily issues that are not a big deal. When we talk about basal cell, squamous cell, we know 100% of those are due to sun exposure. We know that it's cumulative over your lifetime. I think some of the older dermatologists might tell you that, oh, it's what you happened in a childhood, but that's not true. It happens every moment of your life. And so any time in your life that you can protect yourself is definitely helpful. The big thing about the sun is there's 3 different layers. There's the UVC layer, which doesn't reach us yet, but soon it will because the ozone is degrading. We have the UVB layer, which is sunburn, but the UVA is really what causes skin cancer and melanoma, and then I have a few of my patients in the room, and wrinkles and also brown spots, and it leads to bad cosmetic outcomes. Unfortunately, sunscreen doesn't get the job done. I usually tell my patients, you know, the sun heats a planet. If you put a little cream on, it's just not effective. There's some new sunscreens that we're researching right now that have reflective capabilities. I'm doing a clinical trial right now with gold nanoparticles, but we're still about 4 years away from having really effective sunscreen. So even if you say, oh, you can wear sunscreen, it doesn't get the job done, and again, it wouldn't be the #1 cancer in the human body. The second thing is the UVA is really the layer that we want to protect from. That's the damaging one because it goes so deep. And then, you know, let's talk a little bit about clothing. You know, what is an SPF of a white t-shirt? It's about 2. So, and that's SPF is just protecting the UVB rays. Now remember, the UVA are what causes skin cancer. A white shirt has very little to no protection against UVA. UVA goes through your windows. I have this picture, I'll let the front row see it. This is a woman that is a seamstress, and she sat by the window, and on one side of her face it's completely wrinkled and has huge skin cancers, and on the side that her sewing machine faced away from, she has no wrinkles. So it's not just being out in the sun, but the UVA can penetrate through glass and windows. So that's how powerful the UVA is, and it definitely can penetrate through clothing. The FDA has recommended new sunscreen laws. Unfortunately, they can't enforce them, so sunscreens are now supposed to be regulated that say they prevent skin cancer, but I will tell you most sunscreens that you guys are buying over the counter at CVS and Target are doing very little for you. You know, we have better ones at the at our offices that are good, but they're still not going to get it done. So, you know, what else can we talk about? You know, let's talk a little bit about clothing because I think it's important. So when you look at clothing, you know, when you look at protection, there's many ways to approach it. First of all is don't go out in the sun, but we want to enjoy South Florida. I grew up in Indiana. We had horrible winters, and so we definitely want to enjoy ourselves. I think it's great that we're all athletes and you guys are sunning. We want to cover up with clothing. That's when, you know, when I go out on the beach, I'm like, where's Waldo? I wear this coat around, not because I'm cold, but somewhat for sun protection. We want to use sunscreen. We want to keep kids out of the sun. This is a big deal. Children's, I don't know if you have any here, but their skin is so thin, they're going to get a sunburn much faster. Same thing with our wiser, older population. If you're over the age of 60, your skin is also much thinner, so the damage can happen much faster. So clothing, you know, if there are sun-protected clothing, and that is helped. But the problem with clothing when we look at it as dermatologists is clothing have little holes in it. So microscopically, I'm not a seamstress, but when you shine light through, it goes right through your clothes. So even any protection, but white is unfortunately the worst. If you look at the dyes that are used, the darker clothes will absorb the dyes. And so, I mean, this is, I don't want no one throw anything at me, I'm just a visitor. But darker absorb more UV than lighter colors, and that's going to protect your skin more from the sun. The more bright the color, the better. So my green, and the green that we have for St. Patrick's Day is a great color. Bright blues, bright reds, bright yellows do better at reflecting and absorbing the light to keep it from your skin than your other fabrics. We have done lots of studies, and as you know, we also have UV protected or made clothing. That one's a mixed bag. I still buy it for my kids. The problem with those are the chemicals. Number one, we use chemicals for the UPF sun protection on the clothing, and they wash out. You know, there's studies that show after 10 washings, you're going to wash that protective chemical off of those clothing, and they're expensive shirts. You can spend anywhere from $60 to $100 on those UPF clothing. And so after you wash it 20 to 50 times, we think there's no protection on those particular. The other thing is I'm a huge organic person. When I moved to Florida about 3 years ago, I was at Baptist in the oncology ward, and there were these 21-year-olds with these huge tumors. And I said, what is going on? Turns out these were the migrant workers that were picking the oranges, and they were being sprayed with the chemicals, and they were getting these horrible cancers. So I think anytime as a doctor I will tell you not to put a chemical on your body. That includes sunscreen or even the clothing when you get wet can rub off into your skin. That's the other thing to look at. As you get wet, your fabrics have even less protection. So if we're out there playing tennis, you could definitely have even less protection. So, I think those are, from a dermatologist's point of view, I want to keep you all as healthy and safe as we can and try to prevent skin cancer on all of you. So I'm happy to take any questions or just finish my portion of the program. Dermatology question, yes. Yes, sir.
Thank you for your presentation. Based on that, I just have one quick question. I've been a member here for over 30 years and played more golf than tennis now. I was just wondering if there was any data on how many members in the last 30, 40, 50 years we may have lost due to sun-related skin diseases.
There's an answer perhaps in the back. I don't have that, but it is.
I so swore I wasn't going to say one word tonight. I'm so sorry that I don't know that we know that, but I wondered if I had one question to ask everyone in here. How many of you have had a basal cell removed from your bodies? How many of you have had children or family members with basal in addition? So I'm only going to say one more thing, and I'm not even going to ask about the melanoma. Usually when there's a problem, there are many solutions to one problem, and we shouldn't just pick one solution. And if a dark color might save one person from having to have surgery or have a melanoma or have a basal cell, one person in the whole club, out of our 290 families. How can we not do this?
Thank you, Dr. Waibel, and we certainly will yield